My name is Jose Abrigo. I'm the HIV Project Director at Lambda Legal. Lambda Legal is the oldest and largest legal organization dedicated to the civil rights of LGBTQ people and people living with HIV. I oversee our national impact litigation and policy work related to HIV. I oversaw the national amicus strategy for this case, for the Braidwood case, and also I'm currently organizing the national response to the Braidwood case as far as policy work. This case just isn't about PrEP, although it's an important part of it, and that already makes it life or death. This case is about a pillar of the Affordable Care Act, the preventative care pillar of the Affordable Care Act. Cancer screenings, diabetes testing, maternal health services, STI screenings, and yes, PrEP, the daily pill that helps prevent HIV and is a cornerstone to our fight to end the epidemic. If the court rules against the government, insurance companies could be allowed to stop covering essential services without cost. That means people will be forced to choose between putting food on the table or getting a mammogram or meeting their basic needs rather than accessing HIV preventative care services. This case is about a group of activists who are trying to insert politics in a realm where medicine should decide what our care should be. It would devastate the work that I'm doing, and it would harm the folks who I've been fighting to protect for the past 10 years. Health equity and access to healthcare is crucial, and without the Preventative Services Task Force making these decisions, saying that that insurance companies must provide these services at no cost, it would disproportionately impact Black communities, Latinx communities, LGBTQ communities, and folks living in poverty. It would deprive them of essential medicine and the essential care that they need in order to stay healthy. It would have devastating effects to the public health system and would really set back our fight to end the HIV epidemic by 2030. It's a technical legal argument that the plaintiffs are making that basically the Preventative Services Task Force, who decides what preventative care must be covered, should have been appointed by the president and confirmed by the Senate. It's a technical legal argument that they're using to attack preventative care as a whole. So the best case is that the Supreme Court will uphold the Preventative Services Task Force, uphold the ACA, and make no changes whatsoever. Another outcome is that they could overrule the Preventative Services Task Force, therefore removing all of the requirements that insurance providers have to cover no-cost preventative care and start imposing charges, which again would have devastating impacts. There are so many studies that show even a $1 increase in preventative care will lead to people no longer utilizing preventative care. So it's crucially important, especially for low-income communities, to keep preventative care no cost and increase accessibility. This case affects 150 million people, nearly half the nation, and it's essentially trying to strike down one of the most popular provisions of the Affordable Care Act: no-cost preventative care. The vast majority of the public, this is a nonpartisan issue that's popular on both sides of the aisle, and the public should stand up, educate their neighbors, speak to their congresspeople, and say that medicine should not be politicized and that healthcare must be based on medicine and not on radical ideology.